3.5 months, over 2,232 people have died on this island due to COVID-19. Our first thoughts must be with their families and loved ones, especially those of the 39 people who have passed away since this day last week. The sheer scale and pace of the impact of a pandemic such as this has not been experienced for 100 years, and it continues to impact on nearly every corner of the world. When we look back at the accumulated figures for cases since early March, there is no question that a severe response was required both here and internationally. For the purposes of deciding what we do now and in the coming weeks, the obvious focus has to be on the number of cases which are still active and those who are struggling to overcome the disease. According to yesterday's statistics, in 92% of all positive cases, it has been confirmed that a full recovery has been achieved. Our hospitals are operating well within capacity, and there is no urgent or likely risk that they will be overwhelmed. By every reasonable measure, it has been correct that major elements of the severe lockdown required in March are now being unwound here, just as they have been in most of Europe. However, there are serious issues which we have to address concerning how we move forward and how we tackle the social and economic impact of the pandemic. I think we should acknowledge the concerns raised in the letter published earlier this week from a significant number of scientists about the pace of reopening and their concerns, as well as the clarifications which have come since then and the opposing views which have also been aired. I've often said that it's important that we have challenging voices in this debate. They have urged a level of caution which is unusual in terms of the advice being followed in countries comparable to Ireland. Clearly, this links directly to a concern that people might believe that the threat is over and would allow a significant increase in transmission. The evidence from countries which are far more advanced than Ireland in reopening is that there are two keys to preventing a significant increase in transmission. The first is to do everything possible to reinforce appropriate behaviour, and the second is to be able to rapidly test, trace and isolate when symptoms emerge. My party believes that there is significant work to be done in both areas. As we have been saying for some time, the emphasis in public policy and communication needs to be on more than explaining restrictions. It has to encourage people to act appropriately, irrespective of the level of restrictions. Once people are able to leave their homes, it doesn't matter much how far from their home they are allowed to travel. What matters is how they behave when they travel. We should all be concerned that public perception of how people are complying with restrictions have fallen in recent weeks. It's long past time to require masks in various settings. Both the World Health Organization and the European Centre for Disease Control have said that masks should be used in public transport, shops and similar settings. There is no evidence of masks causing harm and mounting evidence of them preventing the spread of the virus. This is because the masks both physically limit the virus and, crucially, also encourage greater awareness of proper behaviour. I believe the messaging hasn't been clear enough up to now. And let's be clear, the idea that you can only require masks if the state provides them is absurd. They are cheap to make, and every country which introduced rules on face covering has been able to implement them without discrimination and without state schemes. In the weekly research published yesterday, 84% of people said they would wear a face covering if required, but only 28% say that they're using a mask. We also have to be unambiguous in saying that we have the capacity to rapidly test, trace and isolate new cases. While the number of close contacts per case has risen slightly, it is only a small fraction of the figure from March. If we have the proper capacities in place, then we can move forward. I would point out that we still have not received a proper report on estimates of untreated illness and other factors which relate to assessing the impact of restrictions. After 3.5 months, the secondary impacts of the response to the pandemic have started to become clearer and require our attention. Mental health research has shown that up to 1 in 5 people can suffer a significant level of psychological trauma during major emergencies, including pandemics. The Department of Health's weekly research has shown high levels of stress, which is consistent with this. We need an urgent plan for how to increase mental health supports immediately and in the coming months. We also need to move more rapidly to achieve greater clarity on what will happen with schools. In many countries, special needs services have been maintained or have been reopened, and I believe every deputy will understand how the families of children with special needs urgently want a commitment concerning July, and I know that the government and the minister are working on this, because for these children and their families, the lack of expert and structured supports, which are only available in the school setting, is having a deep impact on them. And they're rightly calling for everything possibly to be done to avoid their children losing over 6 months of essential support. Distance learning is not an option for them. To be fair, many teachers have continued with that since the schools closed. Only the teachers and assistants working in schools really have the expertise that the children require. And I do believe there's a bit more clarity perhaps required. I think the Taoiseach in his speech mentioned we are dependent on teachers and childcare coming forward. I think we'd like to know if there's ongoing engagement with the profession and the likelihood of the services coming together. While this week's loosening of restrictions on some businesses has been very welcome, we need to realise that our businesses, and in particular our small businesses, are caught in their biggest ever crisis. We still have roughly 1 million people receiving some sort of pandemic-related support, and the numbers are coming down exceptionally slowly. In many cases, industries are coming forward with plans for how they can safely reopen, and they are desperate for more urgent engagement with their concerns. Hairdressers are looking throughout Europe at measures which have enabled reopening and want to implement them here. And I think they deserve a comprehensive reply, and I know the government, there's engagement there, and I think the nation awaits with bated breath in terms of the developments there. Some more challenged and can manage it a bit more than others. Our SME sector as a whole needs a systematic plan for how to get back on its feet. Measures announced to date are welcome, but they barely scratch the surface of the challenge of preventing pandemic costs being a millstone around the neck of Irish businesses for years to come. Ultimately, there is a major series of financial, legislative and policy measures required to help us recover from this pandemic. As we saw last week in Germany, the pandemic has changed the basic rules of what level of intervention should be considered and the role of government in leading recovery. Yesterday's childcare measures are welcome, but they may not go far enough. The continuation of the wage subsidy scheme in this sector is an imperative, and protecting the viability of existing childcare providers paramount, particularly so as to enable a full retention of qualified people and childcare workers in the sector itself. Is leir fós go bhfuil géarchéim file ann, mar leis na gnóthaí beaga ar fud na tíre. Tá géarchá ann plan cuimseach a chur ar fáil dóibh agus gach taíochtas féidir a chóirt dóibh. Caithimid bartis airgeadis, reachtaíochta agus polasathe a chur a bhaim chun donnaing leis na feibanna atá ag na gnóthaí seo. Tóg mar hampla na grúgarí, tá sa going go bhfuil siad ag dag a bháil leis an rialtas a láthir, tá planana a chun donna món ibre a ríist, agus tá an tír ag feitheamh ar cad a thar-lóig. Ireland needs a comprehensive and urgent strategy for recovery, and this is something which will not come while we have a caretaker government and a barely half-functioning parliament. There have been comments in recent days suggesting that even if the majority of members of this House elect a government, it will somehow be a conspiracy against the people. I think the aggressive populist tropes involved in this are not something which can distract us. Mar is léir doing, tá géargá rialtas a chur le chéile sa tír seo agus an dacha seo, tá feibanna áil mhór amach roing, ní féidir le aine is sin a héine, rialtas le trámlach sa Parliament seo, agus beag an rialtas sin den lachach. Agus tá policy féile ag gach éon grúpa sa Parliament seo, agus is rud ná dúrtha páirtithe éagsúla tacht le chéile ar bhatha le pobal na tíre. My party continues to work with others in urgency and good faith to try and form a government which our country clearly needs. Should a government be agreed, it will have both democratic legitimacy and a democratic imperative to act. We have not even begun the work of recovery. To genuinely move to the next stage of the response to the pandemic and to plan and implement recovery, we need a fully functioning government working collectively and implementing an ambitious plan of recovery. For our part, we'll do everything possible to make sure that this happens with genuine urgency and that we begin to show people that our country will recover. Thank you.